So I will grab the, good afternoon, and I will grab the momentum of the excellent previous speaker and try to catch him at least in the half. So what I'm here to, I'm a consultant general practitioner from Gorani Clinic in Kosovo Republic, and I'd like to speak about today, our session will be about how to maintain pressure and secure hemostasis. And I will present also the Comprehend Real World Registry that we performed there. What is the definition of hemostasis? As well know, hemostasis is a mechanism that leads to cessation of bleeding from a blood vessel. It is a process that involves multiple interlinked steps. This cascade culminates into a formation of a plug that closes up the damaged side of the blood vessel, controlling the bleeding. It begins with a trauma to the lining of the blood vessel. But there is a crucial last part. PTCA nowadays have a plethora of materials and products, also techniques, and of course, extremely skillful physicians, all of you. Every step of the entire procedure already have a brilliant innovations at the arsenal, many of them. Only the last and the extremely crucial part of the PTCA procedure still stays at the golden era of the sandbag. Because as you all know, all of us know, if you maintain the pressure, you secure the hemostasis. That's because we need the sandbag. What is the challenges in the femoral artery puncture site closure? Vessel puncture site closure is accompanied by several risk factors, which may lead to serious complications. Some examples. AV fistula. I'd like to show first this one. This is AV fistula that is identified after 27 years and leads to a journalism and leads to a heart failure. When the fistula has been done, again, heart failure will happen. So it's there. What is fistula, you know, but I have to tell it. Unwanted connection by blood flow between femoral artery and vein often results of a surgical technique and the belief in their own capabilities of experience many times. Often occurs in the puncture is too deep. If the puncture is too deep, artery and vein hit. Problematic if not discovered and treated. Caution already at the beginning of the process. Vascular surgeon during a fistula operation to his student in German university saw this. Let's go. Some of the other complications can be pseudoaneurysms, retroperitoneal or not retroperitoneal bleeding. Common complication can be pseudoaneurysms or aneurysms. Sometimes air embolism, not too often. Thrombosis. Some of the most major ones are aneurysms and painful claudication. You can see there some of the occasions. And this is a real hematoma from a German hospital again. The patient was well known to me and he sent me the photos. Life-threatening with a fistula existed. And often this is maybe a signal for a pseudoaneurysm. So why compressive aftercare makes sense? Compression in the puncture site secures the closure, also in conjunction with invasive closure systems. Block leakage is avoided, reduction of the incidence of a complication at low cost, and further cost savings, of course, as expensive follow-ups, operations that are avoided. Some ways of safe compression, some approaches. How to secure the hemostasis after manual or other compression is, first of all, sandbags, the golden era, as I mentioned before. Intravascular systems, Perclose, Angiocell, and dozen of others. And Premofix Uno, this is the Arcticolics, dedicated femoral closure device, the third one. What is the complication? What about sandbag? Is there any complications? Yes, there are major complications. The risk ratio is significant. The major bleeding is really significant. Pseudoaneurysm exists in very high levels. Excess risk of hematoma, yes. In big dimensions. Fistula, yes. Published. If we want to go to the latest trials published in nowadays, we can see that also Perclose, I've just chose two, Perclose and Angiocell, the complication to unrupted aneurysms are 10%. Complications to the rupted ones, aneurysm, I mean, 2.3% in the literature. And these results are with 6 to 8 French sheaths. Maybe we didn't monitor in bigger ones, such TAVI or bigger arteriotomies. Let's go to see the third choice, that is a manual compression until first hemostasis is achieved. Because, and the advantage is that you have full control of the punctural site and time to talk or adjust to the needs of the patient. And of course, the Premofix Uno application is, as you see, I will describe it a bit. This is a non-woven material that can be applied around of the legs with a polystyrene plug here that can focus the pressure to the puncturing site. So with this way, this is a traumatic, this is has big advantages in the longitudinal elasticity, but not to the vertical. So it addresses the pressure just to the side. Of course, this is talks. Let's see what this product, specific product, this approach, in the Copernicum study that we performed in Kosovo Republic in the Clinical Center of Kosovo, has done. What is the aim? It was the effectiveness of the femoral bandaging compression system. What is the trial? A retrospective registry evaluating the safety and the effectiveness of a dedicated femoral compression device, DFCD, from now on, for maintaining hemostasis after percutaneous coronary interventions. What was the research institution? It was University Clinical Center of Pristina Republic, Kosovo, and the study director was Assistant Professor Dr. Daoud Gourani, that is the director also to the Interventional Cardiology Department. What is the study background? The study background and the challenge. Percutaneous coronary intervention have achieved minimal trauma goals, but the crucial final step, I'm saying again this expression, final step, securing hemostasis after closure doesn't always meet expectations without major complications. Ready-to-use femoral bandaging compression solutions were not available until recently to maintain effective hemostasis. This is the juice. Ready-to-use, I'm reading again, ready-to-use femoral bandaging compression solutions are not available until recently to maintain effective hemostasis. What was the study objectives? To assess the viability and short-term outcomes of securing manual compression hemostasis through a special bandaging compression system after femoral coronary vascular interventions. Let's go to the first one, the first goal. Evaluate safety. Is it safe? Assess the safety profile of the dedicated femoral compression device. 2, measure effectiveness, how effective it is. determine hemostasis maintenance capabilities. Third, monitor outcomes, track short-term patient outcomes and complications. Study design. That was a post-market retrospective registry conducted from January 2022 to December 2022. The patient population was 2,000 patients undergone femoral coronary intervention, all receiving dual antiplatelet therapy post-procedurally. Data collection, how we collect the data, clinical data, procedural outcomes, and clinical follow-up extending, sorry, once more. Yes, no, one moment. Sorry for that. 2,000 patients underwent femoral coronary intervention, all receiving dual platelet therapy. Collection, clinical data, procedural outcomes, and clinical follow-up extending to 12 months were obtained for comprehensive analysis. What was the study endpoints? Hematoma and swelling at the puncturing side was the principal study endpoint for safety assessment. And the secondary one, it was puncturing site pain, coldness in right of left foot, pain while walking, and need for surgical reconstruction after aneurysm or pseudoaneurysm formation. Patient demographics. 2,000 total patients enrolled in the study. 68 was male, 60 years old, with a body mass index 27, so they are obese, more or less. 32 was female patient, mean age of 71 years, with BMI of 25, not obese but not thin. And their previous medical history was previous PCI 29 and 42 respectively, and diabetes mellitus for both the groups were almost 30. So what was the results? I have to mention here that I'm not including the hematomas because there was none hematoma, a major one. So we are mentioned only the minor hematomas, that is 1.8%. I think we have to agree that is very, very low. The minor pain was 72 patients. The previous one was 36. It's 3.6 of all the group. And I want you to address your attention here. It is 0. That means no coldness in extremities, no walking pain, or any surgical reconstruction needed. 0. This is a published paper on your disposal. So it is in this trial, we saw an excellent safety profile. 0 cases of coldness in the right of left foot reported. No patients experienced pain while walking post-procedure. And the very crucial one, 0 surgical reconstruction needed for aneurysms or pseudoaneurysms. Study conclusions. The use about feasibility, safety, and effectiveness of the programming the trial. This use of the dedicated special ready for use femoral bandaging compression system, DFCD from now on, is feasible, safe, and effective for the maintenance of hemostasis after femoral percutaneous intervention. So it's innovative, ready to use compression solution. It's safe, minimal complications observed or none, and effective because the successful hemostasis maintenance achieved. Thank you for your attention, and don't forget, it's the last piece that makes the puzzle. Don't forget it.